Good morning. I hope that you all online can hear us this morning. We've got a few people in person. We've had some technical difficulties this morning, so I apologize. Our usual sound person was not able to join us, so we are going to speak loudly and do the best we can, as we do during these strange times. But I'm really excited that all of you are joining us this morning. This is our monthly 100 Families Alliance meeting. The Alliance, including everybody in the community that's working together to really improve the community and see what we can do as a team to work with families from crisis to career. So that's why we're here today. And I'm very excited to get started this morning. I'm going to introduce some special guests. We're going to skip, again, I apologize for the technical difficulties. We're going to skip the video that we're going to show, but I do want you, if you have opportunity, to go to aliceandar.org. So that you can listen to some stories of Alice that have been collected. It's a storyteller series that have been collected through partnership with Winrock. And there's a lot of really good information there. So I'm sorry that we can't show those this morning, but like I said, we pivot. And so we're just going to go ahead and jump right into the conversation today, which is a really important one. For us to have, because Alice, I think, is something that we haven't talked a lot about in this community, but it's something that we should. So in conversation with Marie Robinson here, who we introduced last week, we decided that this would be a really good topic for us to discuss as a group for this month. And so here in the room, we've got Marie Robinson, with 0 to 3, and she's part of the Safe Babies Court team. But this morning, she's also wearing a hat for child welfare, which is the world that she spent many years working in, as well as Anita Bracken, who I'm very excited to introduce. Many of you probably haven't had a chance to meet Anita yet, but she's the brand new, how many?
2 weeks. 2 weeks as of today.
2 weeks at the chamber, yes. The VP of Workforce? Yes. Yeah, excellent. We're very excited to have you. So thank you for coming. And probably many of you know Mr. Jared Rigo, very active in the community. He's here in his role as vice mayor, among other things. So we appreciate you joining us this morning. And so just jumping right in, we're going to do some discussions here. I've got some questions, and we do have, if you're here in the room, there's a handout, and we'll send that out when we follow up with the meeting recording. So the handout here is, who is Alice? And Alice is an acronym, right? It stands for Asset Limited Income Constrained Employed. And, there's some more information here about Alice households. Alice households have incomes above the federal poverty line but struggle to afford basic household necessities such as housing, childcare, food, transportation, and healthcare. So I think all of us know Alice. I think a lot of us have been Alice at some point. And so I just wanted to introduce Alice, but with some data, right? So 2018 point in time data for Sebastian County. We've got 51,739 Alice households in Sebastian County in 2018. Median household income of 46,826. So Alice households are 28%, which is pretty high. So this is a group that is above the poverty line, but still struggling to meet those basic needs. And when Marie and I were discussing this meeting, planning the meeting, there weren't a lot of resources that really cater to that population. We really focus on those in poverty, but there's a reason that we can kind of expand that. I also, real quick, and then we'll get into our discussion here. If you all have an opportunity to see the Engage magazine from the Arkansas Community Foundation, they featured Alice in their May 2021 report. And it's some really good information, so we can follow up with this report as well when we send out the meeting notes and the recording. But real quick, I'm just going to read this message from Heather Larkin, who's the president and CEO. That's her message called "Keep Alice Families in Mind for Giving Decisions." So again, they're highlighting Alice in this magazine, and it says, when we think of our fellow Arkansans who need help, we often think of the very poor, those without jobs or homes, or while making giving decisions, we consider giving to the arts, healthcare, or other organizations that expand the standard of living for us all. But when we take a look at the data about asset-limited, income-constrained employed families, whom we call Alice, it is clear that these families should figure into our giving decisions. Alice families are the working poor with income above the federal poverty level, but not high enough to afford basic household necessities or save for the future. These families are sliding through the cracks of our society, and they deserve our thoughtful consideration and support. In this issue of Engage, we hope to raise the awareness of Alice families who take many forms. Families with two incomes who cannot make enough to save for budget-busting events. Single parents working multiple jobs to go to school to improve their income capacity. And older Arkansans making choices between medicine and rent. These people are working hard, sometimes at 2 to 3 jobs. They're doing everything within their control to do it right. We can help make a difference as they work to move a step up on the sustainability ladder by supporting community colleges that advance their education and earning power, policy change organizations like Arkansas Advocates for Children and Families that advocate on their behalf, or efforts like the Community Supporters for Early Childhood Care and Education Fund at Arkansas Community Foundation that helps ensure quality daycare for children in Northwest Arkansas. So I hope this issue of Engage provides new insight into the lives of our neighbors and how we might help. It's also exciting in this issue is featured one of our other guests who's online here. She's joining us virtually, Molly Palmer, with Heart of Arkansas United Way. So we're very, very excited to have Molly here as well. And we're gonna, and so we're going to have our hybrid today, and like I said, very excited to have all of you here. So the thing that stands out to me with Alice, you know, as we have discussed, they're not in extreme poverty, this specific designation, but they could be, right? They're on that edge. They don't have savings, and they don't have the support systems that many of the rest of us do. And so, Marie, you have a lot of experience working with child welfare, as we mentioned. And there's been a focus recently on preventative services in child welfare, which we want to focus on as well. And I think it's a really, really good move within the child welfare system, but there's been some legislative changes, family first legislation. If you would kind of talk a little bit about that and why that was important for Alice families.
So the Families First Act came about, and they are focusing on a lot of preventative services. It changed a lot of the funding for preventative services. So now there's Title 4E funds that are able to be used for preventative services. So what that means kind of in a nutshell is that the federal government is going to give more money than what just DCFS is having to pay out. So that gives access to services like Safe Care, which can go into the home and help mom and baby with more for Garrett's Law cases.
What is it? Yeah.
Garrett's Law is where a child is born with illegal substances in their system. they were exposed in utero. So there's different programs like Follow Baby Back Home, different things that didn't have enough funding is now being more funded so they can reach more families to help prevent removal, and it's the most at-risk children. So being able to prevent them from coming into foster care is just really helping the community overall, because you're having less trauma and you don't need as many foster homes to serve the children that already aren't here.
Yeah, and what do some of those services look like?
So there are different types of services that can be used for preventative measures. Specifically for the Family First Act, they want evidence-based services. So there is the active parenting program. There is, Safe Babies is actually bringing in some new parenting programs. Safe Care is one of the biggest ones that I can think of right now, but any type of in-home service, intensive family services through the guidance center, just different things that they were having to use contract dollars for, and now they can use different funds for it. Everything they can bring in.
Yeah, so from what I'm hearing, it sounds like the key is support, right? Supporting these families rather than punishing them.
Yes. Kind of wrapping the community around them and making sure that they have everything that they need to succeed. Because Alice families, they can be one stressor, one disaster away from a removal, from falling into poverty. And so if you work 12 hours a day, have 3 kids at home, and you come home and sometimes people just lose it. And they don't mean to, but a lot of child maltreatment happens just from stress. So getting the therapy in there, getting caregivers in there and people in there to be able to help the parents cope with stress, help them to be able to handle the behavioral factors that are happening with their children, and to better understand how to cope in a home where they may be a single parent and working 2 jobs. Just to be able to do all that is really going to help the community.
Yeah. Well, and too, it sounds like what you said. We all experience stress, right? Everybody gets stressed, but when you're at that just above poverty level and you're having trouble with childcare and transportation and all the things that we know, those holistic services that really help benefit the family, that can add stress. And so if we can help to remove some of those, then they can be better parents.
Yes.
Yeah.
And not that they're bad parents from the beginning. Anybody can snap. Yeah. Anybody can have a bad day. So it's really being able to educate, because you see that a lot of people in poverty lack education as well, because they don't have the funds to further their education. So being able to bring that service to them as well and teach, more wholesome parenting skills and things like that to really be able to prevent that child maltreatment.
If you would just, we're going to talk more about Safe Babies Court Team next time, but just give a little plug for how you all provide those supportive services to parents.
So we primarily focus on foster care cases right now, but we are bringing community supports such as the My Parenting program. It's managing youth trauma effectively. So it's an evidence-based program. We have some CASA volunteers trained on that, and some SWS program ladies trained on that, so they can work with the women that are in the SWS program. We are also trying to bring one-on-one parent coaches through active parenting, which is also evidence-based. So we really focus on evidence-based programs and trying to bring those to the community to better serve the population here, because anybody can take any type of program and just check a box, but we're really focusing on how it's really going to impact them and what research and evidence has showed to work.
So community support, very important for all of our families. We're going to switch gears just a little bit and hop over to Anita and talk about many of the jobs that we're referring to. These are some of the lower wage positions, but there's a lot of them, right? Our economy, they're the drivers of the economy. So our economy in many ways depends on, during COVID times, it's that kind of the essential worker verbiage. So if you would talk a little bit about Alice families as drivers of the economy, but then also how these family-friendly business practices also benefit the employers as well.
So from the Portsmouth Regional Chamber perspective, and we are here to support the business growth of the community and ultimately the economic development growth of our community. So the business case is very clear to see how we can help Alice families be more successful at the jobs they're at and the growth opportunities. We know that if a business can attract and motivate and ultimately retain their employees, then they're going to be in a good position to maintain or to grow. And also, as we see a number of these new businesses and entities coming to our region, they're looking at the population and the workers that will fill their many jobs. And just like looking at the percentage of the 28% in the community, like you mentioned, there's businesses where the percentage of Alice household workers is very large. And so in their case, they need these individuals to be there. We've seen the sign that every business needs a restaurant and hiring. And it's just, we didn't see that in the past. And we didn't see some of the companies that had jobs that we would think would be attractive in certain industries to have the openings that they have now. So again, from an economic standpoint, we need these households to be successful and in a good environment so that they're comfortable at work. And then going into how the businesses can support these families. When we talk about the attract, motivate, retain, that area in the middle is really the key part of the companies being able to nurture these workers. Depending on the type of operation, there's some things they can do and some they can't do. But I think part of our role as the chamber is to help increase the awareness of, in this day and time, what do our workers need after they've been through such a challenging year and 4 months as we're going into that. So, a lot of awareness of what are the types of things they can do. And it can be small, but we're all in jobs where we know they're there, for our support and to offer us any type of support that we need. It goes a long way, but I really think encouraging our businesses to have this family-friendly culture, they'll see the benefits in the long run. But again, the number of job openings is critical, and we want to be able, from the chamber perspective, to share out information on how we can continue to support these families, in addition to the jobs that they're in now, the pathways to career development, and that's through education and training, and but also knowing more about the resources available to pay for that education and training. And Arkansas is a very supportive state for the businesses and training of employees. And then, of course, we've got many other federal and state dollars available. But I hope that in my 2-week role here and bringing hopefully an opportunity to share out some things that I came from the greater Memphis region, which obviously has a high level of poverty and much of our workforce there. So excited to support your initiative and to work with our business community and hopefully be a liaison to share out what Alice families are facing, but also the ways that we can support them. And if they're staying in the job they're in, because we know some people have a comfort level of what they're doing, but how can we really help these families look at a way to economic prosperity at whatever level?
Yeah, which benefits all of us.
Absolutely.
Right? Yeah, and the chamber has been a wonderful partner, and so we're very excited to get to know you better and help.
I know I have my colleague Dawn here who shared out this sales.
Yeah, and we've had conversations about how we can partner both with the business with businesses and as well as employers and employees And so, yeah, I think there's a lot of opportunities there. So we appreciate you being part of the conversation. Jared, you wear a lot of hats. You're not wearing one right now. But you're involved in several organizations locally that do interact with Alice families. In addition to being Ward 1 director and vice mayor. So can you describe some of the challenges that you have seen? I know you hear from a lot of people. Some that you've seen Alice families face, specifically in Fort Smith, and then what can we do as a community to help?
Sure, well, it's a wonderful question, and thank you, Heather, for the invitation to be here today, and to my fellow panelists for the great work y'all are doing. Heather alluded to it, I also serve on the board of directors for the Arkansas Family Alliance, which is a nonprofit that does foster family support. I'm on the CASA board of directors, the Literacy Council board of directors, and the Community Services Clearinghouse board of directors as well. And so you do interact with a lot of folks who, from all levels, from poverty, Alice, and above. And I think what it really boils down to is that a lot of folks work really, really hard to make the ends meet, and sometimes they just never quite touch. And whether that's unplanned medical expenses, job loss, automobile repair, home repair, a loss or increase in the cost of childcare, these things can and do happen to any of us, all of us, not just folks that are under the Alice umbrella. And so I think to start the conversation as the community, I think what it's important is that we never surrender our heart of generosity that we have to a spirit of cynicism, and remember that there but for the grace of God go I at any time. So I think it's just very, very important to continue to do things like this, to continue to engage across lots of platforms, lots of entities, just to make sure we don't lose sight of a huge number of people in our community, because the Alice folks, it's about a third, and you combine folks that are actually under the poverty line, there's more people. And so you're looking at a situation where somewhere around half of your folks are really, really facing tremendous difficulty. And so that's something we can never lose sight of, and I'm not suggesting that we do, but we really just have to keep it top of mind as best we can.
Yeah.
I'll say personally, I support and the hashtag Stand Up for Alice. I would encourage people to really look at some of the things that are advocated for here on this flyer, whether it's, supporting those policies and practices that support living wages, or finding pathways for workers to learn more and earn more, removing those barriers to credit and entrepreneurialism, and making childcare more affordable for young families, or even helping to increase that supply of housing. At the city level, there's some things we do, putting that hat on, such as Project Concern with the utility company and the Fort Smith Police Department's Food Patrol, to really try to have that mindset to help people who are facing the challenges and the difficulties. And, I would just say, from a personal standpoint as well, I'm in the process of developing kind of this community revitalization proposal, because I think, and it's designed to really encourage new ways of developing and utilizing some of the vacant, dilapidated, abandoned buildings and spaces in the community, because I think if we can activate those areas, we'll unlock an overall stronger economy. And I think that'll lead to more opportunities, investments in all quadrants of the city. And I think that's just something that we really need to focus on, that'll help the things that are enumerated here on the flyer.
Mm-hmm. Yeah, and a lot of the things that are on the flyer are things that we as 100 families interact with other businesses. So we see those same, and you can see it projected in other communities as well. But yeah, childcare that's affordable and accessible, is a huge challenge. Housing we see is a huge challenge. And if people are working full-time jobs, how hard is it to find something that's going to advance? Or we see people who don't have a GED, working a couple of jobs and kids and trying to get a GED. So the more that we can provide those opportunities for support and to help these families to, as we say, become long-term self-sufficient, right? We want them to be successful over time, because that's really what's best for the community as a whole. And that's one thing, I'm not from Fort Smith, but I've lived here almost 10 years now. And that's one thing that I really love about Fort Smith, is that it is a community. See the people in the room and people online online. And, anywhere that I go, I can run into people that care, that are working toward a better Portsmouth and beyond. So I do appreciate that about this community. I really grown to be very attached to Portsmouth. So welcome. Now we're gonna flip over to Molly up on the big screen. And like I said, Molly's in Little Rock, and we've interacted some on. We've had some Alice gatherings through Winrock, and had a lot of conversations. I've always appreciated what Molly has to say. So I wanted to bring her in here and include United Way partnering with Winrock to highlight what we're talking about. And I know that there's a lot going on at Heart of Arkansas United Way and how you're using Alice data to inform decision making, and why does it matter? Why is that important?
Yeah, so one of the things that, Heather, you've probably heard me say on these calls over and over again with United Ways across the state and with Rockefeller Foundation is this isn't new. This isn't the idea of Alice isn't new. What we have now is data to help us sort of frame and understand the problem a little bit better. And so the thing is, I said that over and over again, is I thought, okay, this isn't new, but it is, we do have the opportunity to make it different. We can make a change and make that this group of people who has existed and worked with us and for us and next to us for years and years and years now, that we've all sort of been vaguely aware of. We have the opportunity now to use that data to figure out how to make things different for Alice. So for us, the biggest piece of what we're doing right now, we're really midstream on grant applications. And so it is for us about kind of taking this information to who are the stakeholders who need to be involved and understand Alice in order to incorporate Alice into our grant making. So the biggest piece of that for us is the group of, I'm sure this is true at the United Way in Fort Smith as well. All of our grant decisions are made by community volunteers. And so making sure that those volunteers really understand who Alice is. We've gotten really, really great feedback so far from our volunteers on just being really excited to include Alice. And again, knowing that this is a group of people we have been serving in some capacity, but being able to really put data around that and numbers around that. So Heather, you mentioned the video that of Justin's story. I really encourage everybody to go and watch that and some of the others. In fact, next week, I'm sending out that video, that very video and another video from that series out to our volunteers who are on our grants committee, because I just think they're such powerful stories and really help people understand what the experience is for Alice. And for me, it's really about this balance of like the storytelling and the data and how those two things sort of work together to help people understand the experience. Y'all were talking about, from the business perspective, what are some of the sort of consequences to business or the benefits to business to serving Alice families and to building out that family-friendly work environment. One of the tools that I have found really useful on the United for Alice website, which is the National Alice Organization, is called the Consequences Report. So it goes into each piece of the Alice budget and says, okay, if Alice can't spend enough money on housing, what are the consequences not only to Alice individuals and families, but also to the broader community? And it's things like, if, I think this is very true in Little Rock, if you can't live nearby where your workplace is and you've got to commute, what's the impact on infrastructure long-term to a community because you just can't afford housing near? Or if you, childcare obviously is a huge, huge, huge expense. And so do you go with unreliable childcare? with a family member who may also have to go and work an hourly job and not be able to take care of your child at some point. And so I think that's a really powerful piece of it, and we'll be using that to talk to our volunteers. We've also taken it to grant applicants, and again, they are very familiar with this. The only questions we've really gotten from them so far are, you mean we can still include people living under the poverty line, right? And what we talk about is we're not meaning to exclude, but to expand the definition of the people that we serve. So my hope, as a result of this grant process and as a result of really asking the question in really broad terms, just how are you serving ALICE families, that what we'll be able to do is take that information of the grants that we award, take the ALICE data, and then figure out where there are gaps. Because I think that there are some spaces where ALICE isn't quite yet being adequately served in our community. And I think that we have the opportunity, by working in partnership with nonprofits in our community, and then also comparing that against this hard data, these numbers that are very real, to figure out where some of those gaps are and make some really specific investments in those.
Thank you, Molly. So like I said, there's a lot of good things happening. And we are just starting this conversation here. I think probably a lot of you haven't heard the term ALICE before, probably a lot of people on the call. And so for us, just starting this conversation and saying how we can do better as a community, not just to serve those in poverty, because we do a pretty good job of that. There are a lot of organizations in the community to do that are doing really well. And we're trying to connect those better, but then also continue that conversation, which is the 100 Families model, from crisis to career. So we want to continue working with families from crisis through ALICE and beyond. So I'm very excited to see what Heart of Arkansas does, and kind of follow in their footsteps in some ways as well through the United Way initiatives. So I'm going to go ahead and jump to questions. Does anybody have questions? And then Karen is going to present some data. Yeah.
Yes, my name is Matt Holland. I'm also new in role. I'm a day 2 instructor here at the university. I work for Kendall Ross. So this question is for Anita and maybe Molly as well. You touched on career retention and like the average tenure for this specific bucket of families. Do we currently have that data to show what the average tenure is for this group of individuals? And if so, is that currently shared with the university?
That would be great to have.
I know you're new in role, but I didn't know if you could leverage off of your previous city's experience, if that's something that's typically done.
Right. Well, we know that in the entry-level position, especially now, that there is a high. I mean, I've had companies that have had well over 100% turnover in their first, and sometimes people don't show back out after lunch. So a lot of it is, getting companies to understand, what these individuals are going to walk into and how do we transition them. Vestigial training, if they start, they get paid, but there's a transition period of getting them acclimated and understand what they're going to do in that job before they go out to the floor. But no, that would be great to know what our business is. A lot of times they can give us their turnover, retention and turnover rates, but if we start pinpointing it to these families, I think that would be a very interesting opportunity to see and to dig in more of well, what can a business do better to support, and not that they better than what they're doing, it's just adding some enhancements to what they do.
Yep.
To onboarding, to ultimately get them successful in the job. And I am a continuous education person, having come out of higher ed, so to get them in programs that our university offers here and utilizing the I'd love to see that. That may be a job that I can
Yeah. And there is a lot of data accessible through ALICE and AR's county level data. I'm not sure if that specific question is available either on the state or United for Alice.
But you said it's at the county level? The
There
data
is county
is
level,
on
yeah,
there?
there is
Okay, that's
some
great.
county level data, but they're still building that out. So yes, to answer your question, were there other questions? Or anybody online, were there any questions online?
In the Hope Park system that you use when you are intakes that you have, how long out? I know we've had some successful outcomes, and we talked about that before. You still try to track them. What is the goal? Like, how long do we want to track? 10 years, 20 years? Do we want to just always have those people in the system to see kind of to gain some of that data from 100 families?
There's no set time limit for tracking families. We do track longer than a lot of other organizations because whether it's child welfare, for example, they're no longer involved with the family once reunifications happen, case closed. But we continue to track with the family past their initial crisis stabilization. So we want to keep working with them beyond. And I think there is a lot of value in seeing beyond crisis stabilization and seeing, what is their next step? How can we as a community benefit? Like I said, beyond that crisis piece. There's not a set time frame. We're working, from crisis to career. So what it says in our documentation is, we'll work with them until they're on a path toward a living wage, which is a little bit great. But we're not in a hurry to hand off the clients. We'll continue to work with them as long as they need us to. And so, we'll continue to be that support and collect data for as long as we need to on that system.
I imagine that the Alice group, statistically, it's hard to track because they aren't in services to possibly, if they are above poverty level, they may not meet ability to get some services. And so therefore, knowing truly what they're dealing with is probably harder to track than below the poverty line.
I think Karen's going to talk a little bit
I
about
want to show you a spreadsheet real quick.
So I'm gonna have to turn this around for people can. So I'm gonna share my screen real quick. And this is just a real quick, oh goodness, spreadsheet to show just what happens with an Alice family. So you have a single parent with 2 children, making $11 an hour, $22,000 a year. That's their monthly income. They get SNAP benefits at that rate at $167 a month. Of course, during the pandemic, they actually received a whole lot more than that, and it ended in July. So everybody that was receiving the extra benefits will not receive them as of July. So you're going to see an increase in food need for sure. $248 in housing assistance is what they receive in this model, for a total of $2,321.67 in income and support. So she goes up to $13.50 an hour. She gets a raise. That's so wonderful. Goes up to $28,000 a year. And that's and that's the monthly rate right there. So she loses her SNAP benefits, and her total monthly income is $2,340. So she increases her income by about $450, somewhere around in there, but she loses benefits of $415 a month. So you can see that why people have that problem. And then childcare as well. That's not even counting the fact that she would then start she would have a copay for her childcare because she would be over for the no copay. She would still receive copay at that amount. So what happens to our families, because like, for example, at Community Rescue Mission, and Heather can speak to this all day long, she will have a 2-parent family, for example, and she'll work really hard to get both of them employed. And at that point, they don't have any ability to get any benefits for housing or anything. Even if they're both at $11 an hour, they're not going to be able to get, a smaller family is not going to be able to get housing assistance from there. And so, and sometimes for our families, it's, you know, it is a hardship, definitely, but it's also just the fact that I'm going from, you know, getting help to not, and it feels like going backwards, even though they, you know, you got to tell them you're truly going forward, but it doesn't feel that way to me. You know, it feels like I'm going backwards because I got this raise and I should be able to make more money. And that's not even counting the fact that, you know, they might have additional taxes or things like that. So that's just a little quick spreadsheet I want to share.
Yes, and that's something that we do see with our families, that once their income increases, suddenly their money doesn't go as far. And that's a concern. It's something that we haven't talked a lot about, that cliff that families have to get over, and the supports that we as a community will need to provide to get them past that cliff. Because I mean, they're not necessarily planning for it, right? They're just, yay, I got more money, I got a raise. And they don't realize always that suddenly their money's not going as far. And so that's, you know, as we're working with these families, it's a conversation that we need to have, and something I think we should be aware of as a community, that it is our goal for these families to be independent of, you know, social services and be able to sustain their families. But we need to have those conversations about, you know, planning ahead. What does that look like for your family? Which is why I'm working with them individually through 100 families is good, but then we also need to have that awareness in the community. So any other questions?
How do you find your participants? How do you identify them? How do they find you?
Just for 100 families?
No, for Alice.
Oh, for Alice. Well, Alice is more of a concept, right? So it's not that they're finding us. It's just a term that we're using to build awareness around a population. So we serve, you know, a lot of Alice families, as I mentioned, but we're not saying, you know, we want Alice families, or we want, we're just starting that conversation. Does that make sense?
Yes.
Yeah.
So I would say on that note, obviously, because we work, all of our families are 100 families, and this is probably one of our biggest struggles, because we do try to get them to independence and stability. And so many of them get so frustrated because then they hit all these roadblocks, and then it's easier just to say, I give up, and go backwards. And that is why so many of our families probably are Alice, or they then take a step back and they're back into poverty, because it's so many roadblocks that it's almost, and it's frustrating as the case managers and as the individuals trying to help these families. I can't tell you how many times I've had to say, hold up, don't take that full-time job yet. Let us help you get into housing, and then we can continue to move you on. Because if they take that full-time job, they're right back with me, which is fine, they can come back to me. But that's not what we want. We want them to have that independence and stability. So it's really working with them and saying, hey, take that part-time job, get you into school, and do all of those things along the way. But if I'm struggling, is that what I want to do at that moment in time? No, I want my own independence. And so it's really difficult to try to help case management and show them that sometimes it's better to go to school. It's better to go to those GED classes. It's better to do those things along the way, so that when you are at a full-time position, you're making that living wage. And Trudy can speak on that, I'm sure, a lot, because her and I probably do a lot of the case management in this area.
I think we create a lot of Alice families.
We do create them.
And that's scary. So we need to figure out how to not create that Alice families.
Yeah, and whether or not, is that a step on the way?
Or
Getting them out of
finding
poverty, what does
benefits.
that look like? Yeah,
Well, we want to encourage them,
right.
but it's so difficult. And I won't say names, but I have a family right now of 6 that's trying to be reunified. So they do not have their children right now. Both parents are working. One's at $11 an hour and the other one's at 13. They qualify for nothing at this point. They're also paying out child support because they don't have their children right now. So even trying to get a landlord to rent to them right now is impossible. But I know if they can get their children back with them, they're not going to be paying out that child support and these things. So I'm taking the initiative and talking to landlords on my own and begging for assistance. It's basically what I've done for the last 2 days to see if I can get them into a place. This is a family that's trying and they've met every goal in their plan, but we hit this roadblock because they are an Alice family right now. Sorry, couldn't mean to.
Oh, no, absolutely.
Can I jump in?
Did you have other data to share? Okay.
I think Molly's trying.
Yeah, I wanted to just go back to that, like, how do we identify Alice families? Because like all of what has just been said is so powerful. And I remember so the origin of this is with the United Way of Northern New Jersey. And I remember having a conversation with the lead researcher up there. And she said, basically they developed this project because their poverty level in their community was actually really low, but the United Way and the service providers that they worked with were like, that's not correct. That does not represent the need in our community and what we're seeing from families who are needing additional support. And so that's sort of, like you said, it's not sort of a self-selection. But I just wanted to say, like, that's the origin of that, is identifying who are people who are still needing support, but are not technically captured by data just yet. And that, this is all based on really localized data. So it is Arkansas's household survival budget, and it's identifying people who aren't making enough money to meet that household survival budget. It's not New Jersey's budget, right? It's not California's budget or whoever. It's all localized to us. And I think, certainly we've talked a lot about like one crisis away from being, from becoming Alice or from falling below the federal poverty line. And like that can be your car breaking down, or that can be a global pandemic. And so I think right now, coming out of COVID, just looking at the number of people who are going to lose those SNAP benefits or lose the additional unemployment benefits and that sort of thing. I think we're going to see a lot of shifting in the next several months over who sort of falls below that Alice threshold.
Yeah, that's good. I'm not sure you all heard her very well, so I'll repeat a little bit of what she was saying about the origin of the Alice Project in New Jersey, that the community actually had a very low poverty rate, but that wasn't reflective of the experience of the members of the community. They saw that people were still struggling, and so that's where they identified the Alice families and the project, and also that she was referring to families being one emergency, one negative consequence away from poverty, and that could be something like COVID. And that's something that we haven't really talked much about today, but it really flavors a lot of these conversations because that's exactly what happened. Global pandemic, people being on quarantine for 2 weeks, no income, and suddenly that tips the scales for that family. Dave, you want to comment?
And then it affected our businesses.
Right.
So we saw business loss by the family members not being able to go, and understandably so. That goes back to the economic, situation of the community is, and then now bringing those families back, and those who chosen to stay on unemployment or had to for various reasons. How do we get those folks back in successfully into, and it may not be the job they were in before that could have gone away, or just giving them an opportunity to look for something different. We hope something different in a positive way.
Right. Yeah, and it's interesting that you mentioned for a variety of reasons that they've, stayed on unemployment or had other assistance or whatever their circumstances. And I think that's a good thing for us to point out is that we talk about Alice as a group, but they're all individuals, and their experience is all different. And that's something that we need to remember as well. There are trends that we can pull out and recognize and address. But each individual is a family with their own struggles, and we want to make sure that we recognize that as well. For those of you in the room, we may try to show that video that I wasn't able to show because I can't do the I'm not able to do the video online right at the moment. But if you're in the room and you want to see one of the Alice stories, then we can do that here. But we're gonna. I thank you so much for being here this morning, and I really appreciate what all of you do in the community. We didn't have a whole lot of time this morning to get into a lot of details, but I know Jared is very accessible and is open to a lot of these conversations, and I'm sure Anita is as well, and we're excited to continue working with both of you. And you'll definitely be hearing more from Marie. She'll be around because we're going to partner on these monthly meetings and some other things as well. So I thank you all very, very much for being here this morning and taking the hour out of your day. And for 100 Families, I am excited to announce that another member of the chamber, Dawn Turner, has joined as our career committee chair. So our career committee had a little career committee and other committees, contact, connection, career, had a little strategy session yesterday, and we're coming up with some new ideas about how to be more effective with our monthly meetings. And so you'll be hearing more about that. Such a really good group of leaders with Heather Sanders, Emily Treadway, they're actually all right there, and John Turner with our committee chairs. So we're very excited to see what they're working on together. And then our next meeting will be August 6th, always first Fridays at 9 a.m. And this next one is going to be more of a conversation about child welfare and the supports that we can provide to the families, including Safe Babies Court team and the team decision-making group with DHS. So that'll be a really interesting one as well. And we would love for you to join all of us. Do any of our partners have any announcements that you all would like to make? I want to make this an open forum for all of you as well.
I will say that CRM has our groundbreaking next Thursday, the 8th at 11 a.m. We will be renovating our main facility and adding 5 more family units.
You get a round of applause. Anything else? Well, like I said, I'm very happy. I love these meetings. I love seeing all of you either in person or online in this new hybrid world that we have entered. And so I hope to see you all next time. Please contact me if there's anything that I can do to help. And have a happy Friday and an excellent holiday weekend. So thank you.
Thank you.